We'll be putting 2 minutes on the clock. Practice these as you would an actual exam question. And of course, your time starts now. Amy Wilson, a 36-year-old woman, presents to the general practice with complaints of irregular menstrual periods. She also mentions difficulty getting pregnant despite trying for over 1 year. Amy has no significant past medical history and takes no regular medications. On further inquiry, she mentions a family history of diabetes. She is a non-smoker and drinks 1 standard drink 2 nights per week. On examination, Amy appears generally well. She has visible facial hair growth and acne. Her temperature is 36.7, blood pressure is 120/80, heart rate is 80 and regular, respiratory rate is 16, and BMI is 32.8. The remainder of examination is unremarkable. Amy is determined to find out the cause of her symptoms, what specific features on presentation would confirm the most likely diagnosis, list 3 specific features. All right, how did you all go? Seeing a few answers popping up. Let's run through some potential practice answers for you. So, again, we're looking at what are the specific features on the presentation that would confirm the diagnosis. And from here, we have irregular menstrual cycles. And this is kind of pointing us towards that PCOS diagnosis, over 35 days, or under 21 days, or absent outright. Putting that would give you a full 2 marks. Given the specificity of it, again, we should be looking at what are the particular criteria for diagnosing PCOS we would be using. If you just were to mention things like irregular or absent menstrual cycles without specifying the timeframes, I think you would still get a mark. Pardon me. But perhaps not the 2 marks as you would for the specificity of the timeframes as well. Likewise, we're looking at those signs of hyperandrogenism, so hirsutism or male pattern balding, subfertility or infertility, and as well looking at some psychological symptoms such as anxiety, depression, psychosexual dysfunction, or possible eating disorders, and again, the metabolic features such as obesity, dyslipidemia, or diabetes. Now, we are getting some good answers here of the excessive axillary hair, acanthosis nigricans. So this would tie into the metabolic features as well as hirsutism, and excellent examples of both of those. I can see as well we've got biochemical hyperandrogenism, fantastic. Polycystic ovaries. Again, on ultrasound, you'd be looking for over 10 cysts. Now, the trick here is in terms of reading the question and making sure that's the one you're answering. So this is the what specific features on presentation would confirm. And so I don't think they would necessarily accept polycystic ovaries, even though that's a thing we're all looking for, really. So just be cautious that you are answering the question that is being asked specifically. Here we have hyperprolactinemia. And again, for there, I'd probably, rather than state hyperprolactinemia, I'd specify what are the specific things of hyperprolactinemia you'd be looking for. Colon tolerance, I think, would be a fantastic answer there. And as for being confused by the question, yep. This is, I think, a situation that you might find yourself on the day as well in terms of feeling like you're getting flustered by what it's looking for. And look, you've identified there that, yes, it's likely PCOS. You've identified, yes, we're looking for the Rotterdam criteria. But when it's specifying for the presentation, it's then about trying to niche that down to, well, how would we be applying that criteria there on the day in terms of how that patient's presenting sitting in front of me? Because at the end of the day, we will be coming up with that provisional preliminary diagnosis based on the patient sitting in front of you. This is where they try to let you know that they're not trying to trick you. They want you to be practicing the way you would in the clinic in real life, and knowing that these are the things you are looking for is kind of the direction they want to lead you. Now, an excellent question there about will we score repeating info from the question. For a situation like this, it's asking what specific features on presentation, there it is, would confirm the most likely diagnosis. Now, this is where sometimes the question will be what additional features of presentation would confirm, in which case they're saying don't repeat what's in the STEM. We want new things or new things you would look for. In this case, it's actually safe to be listing some of the things they've hinted at already, because in this situation, the STEM's actually leading you to the diagnosis. And so it's then picking up, well, what are those features there and what other things would you be looking for? So it wouldn't be repeating info from the question so much as confirming the diagnostic criteria that they fulfill. Does that make a bit more sense, hopefully? Let me know in the chat in the comments there. And this is where, again, getting familiar with the specific wording that sometimes is used in the questions makes a massive difference. But look, I'm very happy to say you've all actually narrowed in and you've got the diagnosis. I think it was just a bit of tripping up over the specific answers that were required. You've done it. Well done. And just like in the real exam, if you feel like you've got yourself a bit caught up, wipe your brow, move on. You've still got plenty of other questions to go, and that is where you'll be able to make up any marks that you feel you might lose from not performing as well as you would want on another question. So let's put 2 minutes on the clock and go for it again. You confirm Amy's diagnosis and discuss management. She is keen to become pregnant as her current highest life priority. What management actions would you take to help her conceive? List 5 specific management actions. Doses are not required. All right, and the time is up. Some awesome answers coming through. Very glad to see. And let's run through some of the answers here. First thing is to remember we can address lifestyle factors which are going to have significant improvement in terms of fertility rates, including the benefits of controlling BMI to under 30 to aid fertility. And as I can see, a lot of you have put in there already. That would be very, very important and would score you 2 marks. Likewise, as most of you have got in there, fantastic, commence metformin. So even in the absence of diabetes, for patients with PCOS with subfertility, which having attempted conception for 12 months and not been successful, would be a very, very reasonable step to take. Again, 2 marks. And again, as most of you have put, referral to an obstetrician for consideration of pharmacological treatment or IVF would be looking at 2 marks as well. Part of that as well, and I can see some people have put for investigation of other causes of subfertility, I think that would also be quite reasonable. Again, it's showing that specificity, and we've made little signs, we're going to put them up on the screen. Showing that specificity of you are referring to X for Y. You're showing that not just knee-jerk, I'll refer to this subspecialty because that's vaguely related to the question. You have a specific intent behind it. And I think as long as you're showing that, that's where you'll get the marks. Now, again, to aid the control of BMI and benefits in weight loss, things like referral to a dietitian for a calorie-restricted diet would be worth points. Likewise, physiotherapist for weight loss exercise plan. If you were to just say obstetrician without any further things, as we said before, you'd lose that specificity and you would be then finding that you would get less marks. Not necessarily no marks, but less marks. It's similar to all patients where you're talking about conception. You'd be discussing preconception counselling, and a big part of that would be folate supplementation while attempting conception. And we did mention in the STEM, it is mentioned in the sense she's a non-smoker, which is why specifically advised smoking cessation is worth 0 marks. So again, stepping through some of the answers you guys have in here. So commence her on metformin, fantastic. Refer to infertility specialist, fantastic. Regular moderate intensity exercise, 150 minutes. I think that would also be accepted in place of, say, referral to a physiotherapist for a weight loss exercise plan. It's essentially you doing the exact same thing. I will highlight as well, the thing I really like about that answer in particular is that you've specified moderate intensity, 150 minutes, 5 days a week, where you could perhaps tweak it in case it reads as 150 minutes per day, 5 days a week, just specifying over 5 days per week, which I'm sure is exactly what you're talking about. But again, just to avoid any confusion, again, it's going to be clinicians marking this, so I doubt that would take any marks away for that, but just really being a bit OCD on that one. And as you've got there, target or a BMI of less than 25. While that would be ideal in terms of fertility in particular, under 30 is generally the target for patients with PCOS. However, I don't think you would necessarily lose marks. They may just give you, say, 1 mark for perhaps incorrect BMI range there. Again, we have fantastic answers here in terms of commencement of oral metformin, encouraging that weight loss, support ceasing alcohol intake, which is one that's not on here, but I think probably would get you a mark in terms of counselling, in terms of preconception counselling. Consider referral to in vitro fertilisation clinic. Now, with that, I'm going to be a little bit nitpicky again, and I'd say commit. If the patient's sitting in front of you, you're not going to say, I'm considering referral. You're just going to refer or not. And so in this exam, you're showing consultant level knowledge. I would just commit and say referral to a fertility specialist or obstetrician for consideration of IVF. Again, specifying why. And advise her to get partner to get reviewed for fertility too. Excellent point. It wasn't in here. Probably would be worth a mark in the actual exam as well. Again, these are those situations where you may not actually have that answer in the rubric, but enough people put that, and I imagine something like that, probably enough people would. They would be likely adding that to give you marks in the actual exam. Here we have weight loss. Again, I would just be cautious to add some specificity to there. So give either a target or a way of doing that. Continue vaginal intercourse for a year. Now, because they've already gone for 12 months, it would be appropriate to consider referral at that point. But as you've just got there in the next line, referral to a fertility specialist. In vitro fertilization, I would be combining those two answers together to give you, pardon me, the specificity back, and refer to dietitian, fantastic, but I would then again tie that back. Why are you referring to a dietitian? 4-meal plan or calorie restriction diet. Arrange OGTT. I would be cautious here because you may be going into what investigations would you perform, and that is unlikely then to be giving you a mark. It would be certainly something you would be considering as part of your workup, but I wouldn't necessarily consider that as a management step. And a question in here as well, wondering if short forms like EG and BMI will be safe to use. So the official answer from RACGP is avoid any abbreviations. The answer from people I've spoken to who actually are marking the exams is a bit of common sense applies. And so the trap they find themselves in is that they can't say what is an approved abbreviation and what's not, because then they're forced to try and maintain lists, and it would just be way too messy for them. So the blanket rule is avoid abbreviations. But if it's very clear in context exactly what you've written and why you've written that, as a clinician marking it, they would be likely to give you the marks, but they can't guarantee it because they can't guarantee that clinician's going to know exactly what that abbreviation means. Sometimes we use, subspecialist knowledge that, or an abbreviation that may be specific to a particular region. And I'm sure we've all worked in hospital settings where people are using abbreviations that are very specific to that niche, and we may be doing that without even realising it, thinking, well, everyone knows what that means, and it may be sent to an entirely different part of Australia where that abbreviation isn't commonly used. So again, I would just be avoiding it as much as possible. Coming up here as well, we have a question regarding the BMI and exercise program. Would you think it is a grouped response? Not necessarily, because while they're ultimately targeting the same thing, I think you would be able to accept a benefits of BMI under 30 to aid fertility that's showing specific knowledge about subfertility and body size. In terms of the exercise program and the referral to dietitian, they're different aspects then of how are we going to achieve that. So they're very related, I agree, but in this kind of instance, they're to target different things. One is the explanation of, and the others are kind of how we're going to get there. But very good question, very good point. All right. Excellent comments coming in, but of course the exam must go on. So let's put another 2 minutes on the clock and we'll get to part 3 for question 1. Your time starts now. And of course, there we go, sorry. Amy returns 3 months later after your last consultation and reports a positive home pregnancy test with her last period 6 weeks ago. She's been following your preconception counselling advice and remembers you advised her to attend for pathology if this happens. Select 5 appropriate pathology tests. All right, and time is up. let's have a look at some of the suggested answers then. And this is one of those glorious situations where there are going to be more correct answers than options you are given. So lots of things you may be putting in here give you the chance to be correct. And the ones that would give you marks, and this is according to RACGP guidelines for first presentation. And again, there's actually more answers on here that are correct as well that aren't on this list, that just due for spacing and time aren't appearing here. So for FBE, chlamydia urine PCR, syphilis serology, urea and electrolytes, HIV serology, hepatitis B serology, midstream urine for MCNS, dipstick for proteinuria, and with or without microalbuminuria. I can never say that one properly. There's always words that trip us up. Fasting serum glucose, and of course confirming the pregnancy with a beta HCG. And that one in particular being worth the 2 marks, the high marks, given we want to confirm. And as I can see in here, you've all got fantastic answers through. And as you've noticed, oh my God, I was worried about this question, wanted to pick so many. Don't be alarmed if you see this. This is a really, really common thing to see, that often there'll be 2 or 3 or sometimes even 4 more correct answers. They're not trying to trick you. Sometimes you may have to try and work out exactly which ones they are going for, but it is very, very easy. Yes, if you're after for the reference for this, I can post up into the description of the video once it's uploaded the reference that I used when putting this one together. Comes from RACGP, and there's a couple of articles from RACGP as well about first presentation in pregnancy. So I'll share that one up there.